I'm sitting here with Mr. Brent Spencer, Dr. Brent Spencer as a matter of fact, who is a board-certified dermatologist on the roof of Nissan and McKinney Buick GMC on the big corner of 75 and 121. Let me tell you a little bit about Dr. Spencer. He's a board-certified dermatologist and fellow-trained Mohs surgeon specializing in skin cancer surgery, Mohs surgery, and cosmetic dermatology. He offers his patients state-of-the-art procedures and the highest cure rates for treating skin cancer, and comes highly recommended. Tell me a little bit about your practice.
Well, yes, we just opened our practice last fall. We're in Frisco, Texas, off the Lebanon and the Toll Road. I'm a board-certified dermatologist, and my main focus is on skin cancer and treating skin cancers. We do a special procedure called Mohs micrographic surgery, and with that procedure we have high cure rates on skin cancers and also keep scars as small as possible. So it offers the patients kind of the best of both worlds. Also, I specialize in cosmetic dermatology. I have additional training in that, and that allows to keep our skin looking pretty. We do things like Botox, Restylane, chemical peels, all those fun things.
Would you say that you have a lot more female customers than male customers, or do you see a lot more men coming in these days?
On the cosmetic side, it's more tilted towards the females, but I mean, we still see quite a few males coming in for even cosmetic things, but skin cancer as well. It's probably 50-50 on skin cancers, though.
Well, I know you've only been up on the roof for about 10 minutes, but it's pretty hot, and if we didn't have this tent here, we'd have direct exposure to the sun, which is what we're walking down the street, we're relatively exposed. What kind of things would you say could help protect me up here as well as some of our patrons?
Well, general sun protection, you need to have sunscreen on of at least SPF 30 or higher, and it's good to apply that sunscreen about 15 to 30 minutes before you go outside. And then once you're outside, you need to be reapplying that sunscreen every 2 to 3 hours.
Wow.
So that's one thing you can do. The other thing is also wearing a broad-brimmed hat. Unfortunately, the hat you're wearing doesn't offer a lot of protection. It does some for the front of the face, but you still get quite a bit of sun exposure there on the scalp with that, and also your ears aren't protected as well. So we like the more broad-brimmed hats that are out there, and those offer good protection. And then clothing as well. There are some clothing lines that can protect you from the sun. Long-sleeve shirts, pants as well. Obviously, it's blocking the sun out, but there's some manufacturers out there that make cooler clothes that aren't so miserable in this heat to wear.
Yeah, well, I can tell you it's pretty miserable, so anything helps. Is there a certain age that's more important to start being concerned about protection of the skin, especially during the hot summers?
Actually, you should be concerned at all ages. Basically, before 6 months of age, we really recommend that you just don't get a lot of sun exposure. Then after you're 6 months old, you need to be wearing sunscreen every time that you're outdoors. There's been studies out there that show that in your first 18 years of life, you can get 60 to 80% of the sun exposure that you get in a lifetime. So basically, you need to be protecting yourself from the sun your entire life.
Now, if someone is diagnosed with skin cancer, what kind of treatments are available?
It's a good question. The type of treatment that I specialize in is Mohs micrographic surgery, and that's it has the highest cure rate of any procedure out there for skin cancer. And that's a procedure where we actually remove the cancer in our office. We analyze that tissue that we remove to make sure that we have it all out, and then we do the repair and we fix the hole that we make. There are some other procedures where, for some more superficial skin cancers, you can do some creams. Radiation is another option, but usually we reserve the radiation for older patients. So really, Mohs surgery is probably the treatment of choice for most skin cancers, especially those on the head and neck.
Well, let me ask you this, and this is not on my question and answer sheet here, but one of the things I've always been concerned about is how do I know that I have some type of skin cancer? Like you get something on your face or your hand, how do you know it's cancer, not just a scrape or a cut or something? How do you know?
Well, that's a good question. There are a few things that you can look at. For like basal cell and squamous cell carcinomas, which are the two most common type of skin cancers, you want to look for lesions that are not healing, kind of think like a pimple that's not healing, just a sore that never goes away. Those are things that you want to look for. For melanoma, the one that is even more worrisome, we kind of have an algorithm that we tell patients to remember. We try to make it easy, the A, B, C, D, E's. And basically, you're looking at dark moles that are asymmetrical. Okay, so if you draw a line down the center of a circle, it's different on both sides. Yeah. B stands for border, so if the border is not smooth but jagged and irregular, that's something that we worry about. And then C stands for color. Different colors within that mole is a bad thing. D is for diameter, anything that's bigger than the size of a pencil eraser, and then E is for evolving. Any mole that's changing or something like that, you need to have checked out by a dermatologist.
Wow. So more importantly is if you think you even would consider or ask yourself that question, don't be the professional. Go to a professional such as yourself and let them determine. That's awesome.
Exactly.
Is there anything else that you would like to tell us about your company or an organization, or anything that can possibly help us treat ourselves better when we're out in the sun and have that sun exposure?
Well, just, between the hours of 10 and 4, that's when the most intense sunlight is. So right now at noon, we are getting the most intense sunlight of the day. And this time of year in Texas, you can be out in the sun for 10, 15 minutes and get a sunburn. So it's really, really important that you have your sunscreen on while you're out here during this promotion.
Trust me, I understand. I understand you got a gift for me as well.
Oh, yes, we did. We actually, the sunscreen here is some Neutrogena sunscreen. It's a very good sunscreen, SPF 100 or higher. And we'll have him to apply this hopefully today.
SPF 100. I think I need SPF 1000. Well, you can find Dr. Brent Spencer in Frisco. Like he said, he's on Lebanon. His email address is this is actually a website.
Yes.
www.dermntx.com. So that would be North Texas, DERMNTX.com, and ask any question you want. Their phone number is actually 972-712-5100. If you have any questions or additional questions, he can certainly answer them for you. He is, like I said, a highly recommended board-certified dermatologist, so if you should have any needs, please give him a call. Thank you so much for being out here with us, Dr. Spencer, and we appreciate it. And make sure that you're looking at our 24/7 live webcast at getchrisdown.com on the big corner of 75 and 121.